Low testosterone can affect energy, mood, strength, and sexual health. It can also affect bones and red blood cell levels. About 10 to 15% of men 65 and older may have low total testosterone. Medicare can help with prevention, diagnosis, treatment, follow-up, and medications. Before we get into low T coverage, it helps to look at what Medicare covers overall. Part A covers medically necessary inpatient hospital stays and skilled nursing facility care. It also covers hospice and some home health services. Part B includes doctor visits, preventive services, durable medical equipment, and outpatient care. Part D generally covers prescription drugs you get from a pharmacy. Medicare A, B, and D can include coinsurance, copays, and deductibles. In this video, we'll walk through low testosterone prevention, diagnosis, treatment, rehabilitation, and medications. Low testosterone is often called male hypogonadism. It means the body makes too little testosterone. Sometimes it also affects sperm production. The two types of low T are primary and secondary hypogonadism. Primary starts in the testicles. Secondary involves brain hormone signals. Medicare Part B covers most preventive services, including a yearly wellness visit. Those visits may support a low testosterone prevention plan. The Medicare annual wellness visits may help start that conversation, but extra tests may be needed and billed separately. A doctor may review sleep, weight, medicines, and health history. Diagnosis usually starts with symptoms and medical history. Low T can present symptoms like low sex drive, fatigue, reduced lean muscle mass, irritability, erectile dysfunction, and depression. Blood testing is a major part of diagnosis. Guidelines suggest repeated testing in the morning for low T. Doctors may also check related hormones to help find the cause. Medicare Part B may cover low T diagnostic tests, doctor visits, and outpatient care, subject to a deductible and 20% coinsurance. This includes medically necessary blood testing. Treatment depends on the cause. Some men may need testosterone replacement therapy. Others may need treatment for sleep apnea, obesity, diabetes, or other health-related conditions. Medical documentation is important for Medicare-covered testosterone therapy. Treatment focuses on symptoms and medical cause. Age-related low testosterone alone may not be covered. Medicare coverage states testosterone treatment may be medically reasonable and necessary for symptomatic hypogonadism due to disorders of the testicles, pituitary gland, or brain, among other listed indications. The same Medicare policy excludes some situations, including aging-related hypogonadism, male menopause, and idiopathic low testosterone not tied to a covered disorder. Low testosterone care often needs follow-up. Doctors may monitor symptoms, testosterone levels, blood counts, blood pressure, and prostate markers. The goal is safer, meaningful symptom improvement. This may involve sleep care or advice on physical activity. Medicare coverage depends on the type of service and medical need. Testosterone medication comes in several forms. These may include gels, patches, injections, or pellets. Some products are filled at a pharmacy. Prescription drug coverage varies by plan rules, tiers, formulary, and pharmacy network. A formulary is a drug list covered by your Part D plan. A drug may require prior authorization, step therapy, and quantity limits. Part B often covers drugs given in medical settings. In most cases, this involves drugs given via injection or infusion, and vaccines for prevention. With Medicare Advantage, additional rules come into play. All plans must include Medicare services. However, the guidelines can change. Network use, referrals, and prior authorization may affect access. Medicare Advantage plan rules can also affect costs and timing. A plan may cover one testosterone medical service or medication differently than another. Costs can also vary by plan and pharmacy. Before scheduling tests or starting treatment, check your plan rules. Low testosterone is a legitimate condition that can be managed. Documentation, cause finding, and testing are crucial. Before treatment begins, ask 3 simple questions. What is causing the low testosterone? Is this covered by Medicare or my plan? What will I owe out of pocket? Clear answers can help you move forward with confidence. Peace of mind comes from self-awareness and action.